Welcome to the University Center of the Mountains Cool Career. This particular session today is going to be focusing on Sullivan University College of Pharmacy and Health Sciences. That's one of our University Center of the Mountains partners. One of the things that a lot of our folks in the area, students, community people in the area don't realize, they can come to Hazard Community and Technical College, get all the prerequisites, all of the courses they need right here at HCTC, and then go directly into this doctoral program here in the state of Kentucky. It's a wonderful opportunity. We have students from our region who are currently in that program right now, one of whom is going to speak to you in just a few minutes. But before we get started with that, I just wanted to remind you that I'm Deronda Mobilini. I'm the Executive Director at the University Center of the Mountains, so we're the Higher Ed or Transfer Center on the HCTC campus. So any students who want to come into HCTC to do their freshman, sophomore years of college are welcome to do so. It makes a great, affordable, accessible, quality stepping stone. And then many of our students move on to my partners, so they become transfer students to get their bachelor's or even graduate degrees, which we're talking about graduate school opportunities today. So just know that the UCM is here on the HCTC Highway 15 campus. Contact me. And I will make sure I get you in touch with the appropriate four-year college, university, or graduate school partner to get you that kind of advising and assistance that you need. So that being said, let me very briefly introduce to you the two other ladies that you should be seeing on your screen right now. I have Jillian Misbach, and she is, well, actually, Jillian, you introduce yourself, your title, and what you do at Sullivan.
Awesome. Thank you, Dr. Mobley. So my name is Jillian Misbach. I'm one of the admission advisors for Sullivan's College of Pharmacy and Health Sciences. I primarily serve the Doctor of Pharmacy program, but also our master's in physician assistant, and really kind of here as the point person for any student interested in pharmacy, not only in the application process when it comes time to apply to the doctorate program, but also as you're completing your prereqs.
Very good. And let's pop over, and Jillian has invited one of her graduate students to join us today, and this is Ms. Murky Sloan. And tell us, first of all, physically where you're sitting right now.
So currently I'm at Hazard ARH doing my third year API rotation. So at this point I'm finished with my classes and I'm just working up to finish my PharmD degree and just working alongside other pharmacists and physicians at Hazard ARH.
All right. Now tell us a little bit about where you're from, where your home is, and how you worked your way through college to get up to Louisville and Sullivan and in this doctoral program.
Okay. So I'm originally from Knott County. I went to Knott Central for high school. After graduating from Knott Central, I actually did start at Louisville College. I only did one semester there simply because they weren't really offering what I needed just to meet my goals as far as, try and get in early decision, just doing my prereqs. So after one semester, I actually came to Hazard AR, or I'm sorry,
I know what you mean.
I came to HCTC just to get my basic prereqs that Sullivan was offering. Through the college, I actually met Jillian on campus one day, and that's kind of how I got interested in Sullivan University. And I actually met with Jillian several times and had a tour scheduled to meet with her at school. And so she just got me really excited, on the right track with my classes, and ended up doing early decision at Sullivan University and got accepted. And now I'm here.
And I remember that. Yeah, we had you because you were still taking HCTC classes that spring semester and in the fall, and we've got the economics, but you got that done. And so you were an early admit, which was very, very exciting. Yeah, and that's one of the things I'm glad you mentioned, that you actually had to meet Jillian face to face and had made that connection early on. Our research and just experience tells me this as well. Anytime our students are preparing for transfer, we try to connect them if they know where they want to go, what they're interested in. We try to connect them as soon as possible with that four-year college or university or graduate program, and we work as a team. So anything, when I was helping doing advising, or Dr. Curry at that time, I think as well, was helping with Murphy, and we would double check with our Sullivan representative to make sure we were putting her in the appropriate classes. That's the whole idea behind the UCM partnership, to support that kind of smooth transition from one point to the other as our students move along. So I'm glad you mentioned that. And we used to have our healthcare career fair, a big conference for our high school students. We could not do that this year because of COVID, hence the reason we're doing the Cool Careers. So it's sort of a face-to-face interaction, but it was at one of those events that I think Murky got to meet Jillian, and then Jillian also would come in when we do some of our different transfer fairs in the UCM, and that's one of the things we do. We try to bring our students in as often as possible to let them connect, talk, visit, and then certainly in Murky's case, she went to Louisville. Now remember, she did her freshman, she had some credits already in, and then realized she wanted to do pharmacy, was interested in Sullivan. So she had some additional prerequisite courses, but she was able to take all of those here at HCTC, which is a significant tuition savings for our students in this region. And then she did move on up to Louisville, which I know sometimes that sounds like big city can be a little bit frightening or intimidating, but I always encourage students, as Murky did, to go see the campus. Jillian, I've taken other students before as well, and she loves to give you the tour. And it's when you get there, you've got that small feel. And I think it's very accessible. You don't feel like you're in a large city. And Murky, you were saying something a little bit earlier about, how you felt like the campus was, in a sense, it felt like it was a smaller town than, say, Lexington or some other sites. So anything else you want to add to that in terms of encouraging students? I mean, how did you feel about going from, Knott County, a small area, you're a rural Eastern Kentucky girl, going up to Louisville, the so-called big city? How did that make you feel?
Well, I had never lived away from home prior to moving to Louisville. So at first I was scared. And whenever I first came to the school just as a tour, it kind of didn't seem that large. I feel like because the school was just kind of like to itself, everybody was so close. As soon as I came in, the dean directed me how to get to Jillian's office, which I thought was really great to have that face-to-face.
That was great timing.
Yes.
Yeah. And just like off the bat, you could really feel like at home with it. And I feel like because if you tour like other schools, it just seemed really crowded. Like the area is really crowded. You don't have that like really hands-on experience with other faculty. And at Sullivan, the moment I came in, I felt that they made an effort to get to know me, my strengths, my weaknesses, even while I was in the application moment. Because when I went for my early decision interview, Jillian and some of our other professors, like Dr. English, who is one of our deans, actually came and talked to me before I started my interview because they had known me beforehand. And it just kind of like reassured me through the process that these people really do care that I'm here.
Yes.
And I thought that was great.
Yeah.
Good.
Yeah. I was gonna say, I love to hear that feedback, Murky, because for any students that, are watching this and thinking about pharmacy, I love to call our campus a family, pharmacy and family. But I think it's really true. I've been in admission for over 8 years. I've been with Sullivan for 4. I can't believe it's been 4. And what keeps me there is the family environment. It's not only watching our students like Murky about to reach her goal of becoming a pharmacist, but also the fact that, we retain amazing professors because they love that environment, and everyone knows everyone's name. And I think that sense of kind of community and family really is what helps our students succeed throughout, because grad school is stressful. Grad school is definitely not a walk in the park. Murky could definitely probably speak to that. But I do think we have something special in that, we've got 50 to 65 students per class. So, for students that are looking for an environment that might feel like Hazard High School, might feel like Alice Lloyd, might feel like HCTC. I think we provide a really great environment like that.
Yeah. Well, and Murky, and coming from Knott County, and that's considered a little bit bigger county high school, but still it's a smaller area. And, those kids, you've all grown up together, gone all through school, and you know each other. So suddenly, if you're going to a graduate school and going to Louisville, like you said, hadn't really been anyplace else like that, to live by yourself, that could be very intimidating. And that's one of the things, Jillian, I was always so impressed with. And when you all were first joining us as a partner, we were talking, meeting, was going up and got to tour the campus and visit and so on, and how very impressed with, how very impressed I was with faculty, the staff. And, sometimes there'd be a student out in the hall I get to chat with for a moment. And, that's always very telling when students, and they'll tell you, on the side, you can talk to them when they're waiting cafeteria, wherever, and, they'll tell you stuff. And then, of course, we now have students, like I said, are in the program, graduated from the program.
Matt T,
yeah. And they're doing well, and they can reinforce that. So I always feel very comfortable promoting my partner, my Sullivan partner in this particular program. Well, okay, so let me ask you this. Let's go back to Jillian. In terms of, and we were talking about this a little bit earlier, obviously a pharmacist, what a person does with that degree, and we're all used to going into the pharmacy, the local CVS or Walgreens to get our medicine. But is that the only thing a pharmacist does?
Yeah. So for students who've heard of pharmacists, chances are we've all met a pharmacist, right? Unless you live in a bubble. So all of us have been sick at some point. And chances are you've probably met with a community pharmacist because they're the ones dispensing your medication at Kroger, at Food Lion, maybe at an independent drugstore that's in your county. So pharmacists, kind of in the most basic definition, are the drug expert. They're making sure that the patient's getting the right drug via the right dosage. That's super important. And, via the right route. When you think about it, there's some really neat problem solving to pharmacy in that, let's say you're working with a pediatric patient, a child. They may not be able to swallow yet. The liquid form of the medication is probably not going to be the best option. And so something that, if you really like problem solving, if you like the idea of helping patients, you like healthcare, but maybe you're scared of bodily fluids. Maybe you don't want to open patients up for surgery. Maybe you don't want to change bedpans, give IVs. Pharmacy is a really interesting part of healthcare where you can serve. So with that in mind, like Dr. Mobley said, where are pharmacists? Well, in the United States, anywhere that a medication is dispensed, which keeps us safe, that pharmacist is kind of at that final step of not necessarily the final step of the process, but they're kind of at the front line and was defense of making sure that our patients are getting the right medication. So, think about it, if you've had a doctor write you a script and maybe it's the wrong dosage, that pharmacist is double checking before it's heading to you. If you've got an allergy, if you've got a drug interaction, again, more and more problem solving. So not only can you meet a pharmacist at Kroger, at Rite Aid, at Walgreens, which is kind of the community setting, but some of you may have met a pharmacist in the hospital. If you got a medication in the hospital, that was from a pharmacist in an IV bag. But also, we've got pharmacists who specialize in, so you've got, you could potentially be a pediatric pharmacist and specialize in working with kids. We have a professor on staff that used to work in the neonatal unit. So if you are interested in working with babies, you can actually, kind of focus even more in that medication. Cardiology, oncology, those are thinking that working with cancer patients, you could focus in that. But also, prison systems. We do have, anywhere that medication's dispensed, you could work for a prison. We do have a really awesome graduate who speaks to our students each year, and he jokes that he gets out of jail every day because that's what he does. Is he works in a max security prison in Colorado. And by working with the federal government, actually his loans are forgiven, I think, after 8 years. So that's kind of a nice benefit as well. Awesome. But a lot of kind of the standard setting that you hear about is community, which, also includes retail like Kroger in that hospital setting. So what I would love to do is kind of spin this over to Murky. So just to kind of walk through real quick for those who aren't familiar, the typical doctor of pharmacy program in most states is 4 years long. We are 3 years, and we're able to provide the same amount of experience that you would in a 4-year setting by having pretty much a year-round program. Now, that doesn't necessarily mean you don't get breaks. We just kind of map our breaks out differently. So instead of having your students have 2-week breaks after every 11 weeks, especially in those first 2 years of school. So you're getting the same amount of experience both in the classroom and outside the classroom that you would in a 4-year setting. But what's really awesome about Sullivan is that you're finishing a year sooner than your peers at other schools. So if you're really eager to be a doctor of pharmacy, like Dr. Mabolini said, the prereqs are offered at HCTC. We do not require a bachelor's degree. We just really need those 2.5, 3 years of prerequisites. That means you can still use some KEYS money towards pharmacy school as well. So someone like Murky, can be from the start of getting her prereqs, can be a doctor in 6 years from the beginning. So for those who are high schoolers, you could, as a high school senior, starting next fall at school, 6 years from now, you could be a doctor. So
Wow.
Murky, I wondered if you could talk about kind of the 3rd-year rotations and what you've been up to in Hazard, but maybe in some other places as well.
Yeah. So as far as rotations, basically what we do is the school allows us to kind of like rank what we're interested in, or even want to grow in. Like if you're thinking, oh, maybe I'm not strong in a subject, put it down, just kind of get your list going. And so after that, you get 7 blocks of rotations. And each one focuses on a different area of pharmacy that you may be interested in. So like right now, this is considered my advanced hospital at Hazard ARH. So what that is I'm with each week different pharmacists, physicians. Last week I got here early, which is kind of not the best, but I got here early and worked up patients and then went on rounds with the physicians. And so at that point I would make my recommendations. If I seen something that could be improved to like help the quality of care, I made that. And the physicians and other pharmacists were really eager to listen to the students because they just love getting fresh input on things. But also if you're not leaning towards hospital, then like last block I was at a specialty independent that focused a lot on compounding. So for that whole block I was compounding like creams and hormones and
So you
things
explain
like
what
that
compounding is.
Oh yeah, I say tell us what compounding is, Murky.
Compounding is when you have one form of a drug and you make it into another form. Some patients want it in like a cream, and if you have a pill form, and it's just we make compounds for dogs and babies. So if you want to work with like little kids, you can. If you want to work with like vets, you can do that as well. It's basically you can do anything with pharmacy if you really have the desire to do it. And I think that's what I've learned so much during rotation so far. I'm just on block 3, but I've learned so much, and Sullivan's given me so many opportunities to work with different professions outside of pharmacy this year that it's unbelievable. And I know like we have like mission trips. If you're interested in that, we have an opportunity to go to Honduras for 2 weeks and do medical missions. I was actually given that opportunity with COVID. I don't think that's a thing this year, but for the future.
But she was selected. Yeah.
Yes. And I think there's so many opportunities. Yeah. Which it still sparked my interest to where after graduation, I still want to pursue that because you gain so much this year. And if you go into it with an open mind, the possibilities are endless, honestly.
Oh. Well, let me ask you this then. So for a high school student who's maybe thinking, and maybe they just know they want to do something in healthcare, but they aren't quite sure what. So, pharmacy might be an option. What kinds of classes would you tell them? Make sure, you take this and make sure you pay special attention to, or take this seriously, or, get in there and learn as much of that as you can. And, that kind of advice from student to student.
Anything medical terminology wise, I would suggest no.
That's a good idea.
Because once classes kick in, there's so much going on, and just knowing those little details could build your knowledge so much. It's unbelievable. It's something I didn't expect whenever I was going through my undergrad classes. Of course, obviously the chemistries are very important. And chemistry, math, medical terminology.
So calculus is probably, yeah.
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 Well, and one of the things I know we will often recommend to students if they come to the community college, when they're taking their anatomy and physiology course, which one of the classes they would take along that biomedical pathway. And we do have that resource guide here at the college on the UCM webpage with that list. If you're prepping for pharmacy, make sure you take these classes so we can guide you with all of that. But often we'll recommend students when they take their anatomy and physiology 1, if you can, take your medical terminology at the same time, because just like you're saying, you're essentially learning a whole new language because you're going into the medical field. It's a new language, another language. That terminology. It's interesting to hear you say that, because I had learned years ago we tend to provide that as advisors. It's good to hear that reinforced. That's still a useful optional course to take as you work through. And some programs require it. Some programs will strongly recommend it, depending on which pathway you're going into. Well, Jillian, let me jump back over to you then for a minute as we start to wrap up. And again, think about these high school students, and if they're thinking about this, what are some other things they need to know, or other things even, it used to be we tell students try to get out and observe. And again, because of COVID, that's really not so much an option just right now. But what are some other things those students could do to kind of help them decide and get focused?
For sure. So, I do recommend obviously we got some decent update news as far as vaccines today. We'll see.
Yes, I was listening to that. Yeah.
With COVID stuff. But, most importantly, something, and actually Murky could probably attest to this. We don't require a pharmacy experience before you start the program, but I do recommend trying to shadow if you can, if it is safe. Obviously, it's hard to shadow right now because the last thing that a pharmacist might want, especially in hospital setting, is another human in the hospital during a pandemic. But what I recommend doing at least is that the easiest pharmacist to talk to is a community pharmacist when you're getting your medication, or maybe your parents are getting, you're going with your grandma and you're getting a soda while they're getting their medications. I do not think it hurts if you're thinking about pharmacy to go up to a counter of a pharmacist and introduce yourself and say you're interested in the career, and see if you could even just have a conversation with them. I have heard from some students, and this is just from some of the applicants that are now students with us that have given me advice. Apparently Sunday afternoons are a good time to try to grab a pharmacist. Every day is probably busy for them, but I do recommend, if you are, it comes time to apply. I definitely have some students this year because of COVID that are like, Jillian, I'm trying to get experience, but like no one's letting me in the door, which is understandable. Is try to have a conversation. I always tell students that if you're going to choose a career, it's like potentially buying a car. You're not just going to drive it off the lot. You want to test drive it, and you want to make sure that you're comfortable with it. So, not to offer up Murky but do you know that we've got some amazing alums from the Hazard area that would be probably more than happy to have a conversation with you if you wanted to connect with someone through Sullivan, if you were kind of intimidated by going to Louisville. But also, and that's something that Dr. Malvolini knows these alums as well. She could connect you with them, be it a Facebook message, be it a phone call, but at least have a conversation for whatever field you're thinking about. Have a conversation with a nurse, have a conversation with a pharmacist, have a conversation with a physical therapist. If you can't get in the door, be with them right now. They might be able to offer kind of a teledoc kind of virtual shadow, or at least just a conversation that helps solidify that that's a path you want to go on. I think pharmacy is a really neat opportunity because of that problem solving, because of kind of all the areas that you can specialize in. Also, there is a need for pharmacists in Eastern Kentucky. So do you know that plenty of our students go to Louisville temporarily for 3 years? We're exactly 2.5 hours away from HCTC's campus. And then they come back to their area and serve. So that is, kind of a goal in life as well for you, is to serve your community. It's definitely something that you can do through us.
And Murky, have you met, I would say Dr. Dunn, she's married now, it's Clemens, but Lauren Dunn.
I know that name. Yeah.
She graduated a few years ago, and she's back in the area and works in this. Well,
and Tyler is too, right?
Kind of back up in Lexington where she got married now, but she was in this area. So I don't know if you'd run into her or not, but we've got, I'm glad you mentioned that, because Jillian, we've got good resource people in the area, are wonderful people, enjoy talking to students. And again, it might be you set up a one-on-one virtual, something of this sort. And, just let me know. I could get you in contact with the different people. That's one of the things we do through the UCM. We're helping you put those pieces together so you can figure out what you want to do, what works best for you. Well, as we wrap it up, anything else that we should have said or I should have asked you?
I mean, I think just one more thing to kind of mention, because I'm sure you're curious with pharmacy. Starting salary is around 6 figures. And then as you grow, it's definitely in 6 figures. And so if you're looking to make a nice amount of money, it definitely is a nice part of healthcare in that. Also, in kind of mentioning, I think especially with it's very intimidating to see whether or not jobs are out there for certain areas. And like I said, there is a need for pharmacists, especially in the Eastern Kentucky community. So if you're thinking about investing in graduate school and you're thinking about that price and you're wondering, is it worth it? Our students are getting jobs and they're getting nice paying jobs. So
pay off those loans.
So do you know that you can not only serve in the capacity that you want to, but you would be able to, seek out positions that potentially fit your need. But if honestly, I love what I do. I think that's the last thing I really want to mention. And then Murky, you're welcome to dive in, but I absolutely love what I do. I love serving students. I love watching our students reach their goals. It's one of my favorite things. So do you know that there's no silly questions? I'm willing to meet with students along the way as many times as they want. That is something Murky and I did, and there's nothing wrong with meeting with me as many times as you did, Murky. I think it's so important to make sure for me that you all are on the right path and that you need what you do. You have an advantage in that Dr. Mabolini is available to you as well, and she's very well versed in our campus. But if you want me to review your transcripts, if you are taking dual credit this year as a senior and you want to see whether or not your dual credit classes count towards maybe some of the electives that we need, whatever it might be, please don't hesitate to reach out because I'm here to serve.
Good. Yeah, good points. And as a part of that, again, that helping and preparing the mock interview skills. I didn't mention that. I don't think.
Oh, yes.
Mentioned that very quickly. One of the things we've learned by working with partners like Jillian and so on, and even actually from students coming talking to me. And as I was learning, and there's some of these students, more and more students started looking at graduate school programs. A lot of them are select admissions programs where you have to write an essay as part of your application process. And you have to go in and do an interview in addition to maybe taking exams or tests beforehand, depends on the program. So anyway, the UCM is trying to provide any additional support services to help you or students move forward with this. So one of the things we implemented just a few years ago, and again, got the idea from students and different folks like Jillian and so on, is to offer mock interview workshops and then actually run mock interviews. Because if you go to Sullivan or any of your other pharmacy colleges, but just a part of that med school, medical lab science, physician assistant, you'll come in and you'll have to do an interview. And if that's something you've never done before, that's nerve-wracking. That can be intimidating. And so we know that, we understand that. Many of us have been there. So we want to try to make that a little smoother, a little more doable or accessible to you. So we've started offering those events. We typically do them in the spring. Last spring, we did virtual or phone conference interviews, which we normally would do regular face-to-face, have you come into a room, sit down at a table with 4 or 5 people interview you, but we couldn't do that. But the reality is that in terms of real business people applying for actual jobs, they were doing it like we're doing now, the more this virtual or phone conference call interviews. So that's perfectly appropriate. And we'll be doing something of the same sort again this spring semester, as our students come through and they need it. And we typically try to do small groups. And sometimes we may have a semester where we don't have anybody who's at that point yet or needs that. And then the next year we may have several students. So anytime there's a need or something of that sort, I always tell students, let us know, and we'll try to accommodate that and support that. We've done graduate record exam reviews, different, just like you take your ACT. There's some different types of professional programs you might go into where you have to take one of those standardized tests, and sometimes you need a little review on a subject area. So we often will try to facilitate that kind of thing. So the UCM is here to support your transfer goals as you move forward into programs such as Sullivan University's College of Pharmacy and Health Sciences. So if you have questions, you want more information at any point a week from now, a month from now, a year from now, 2 years from now, come see me in the UCM. Again, I'm Deronda Mabolini. The number at the UCM is 606-487-3252. And of course, just if you forget all of this at some point, just ask your counselor. It's a lot of information. Ask your high school counselor, your teacher. Who was that who talked to us? How do I get a hold of her? And they'll get you connected. And then I'll in turn make sure I get you connected to the appropriate people at this point on. And I think that's it. Thank you all so much for your attention. You'll study hard. And I thank you too for joining me today. I appreciate it so much. Wave to the students. Bye.
Take care.